Exactly. And the thing about it is that the important thing is not seeing yourself as this junior person that can't give value wherever. Because in my role, even across my different roles, me being at this level has made me so accessible and has made me able to make such a big impact on stuff. So there's no point saying that, I'm too junior, I'm too early
Yeah.
in my career, because even you can make such a huge impact and kind of thinking through that anyone can start anything. Just have that confidence and keep going, really.
Hi, friends. Welcome to my channel. My name is Ego, and this is the Power to Pivot interview series about how we can achieve our life, health, and wealth goals. Today, we will hear from Dr. Derek about his leadership experiences as a qualified GP and also what he's doing in the medical education space and how he's disrupting it with content creation. How are you, first of all? You okay?
Yeah, I'm doing really, really well, thank you. It's sunny, it's a nice day, so yeah, thanks for having me on, and I'm really happy that you decided to take the plunge and actually start this YouTube channel. So you're
Thank
welcome.
you, Derek. You've inspired me. You
Good stuff.
inspired me. You went out there, got onto YouTube.
Yeah, yeah,
So I'm learning. I'm here to learn from you, and I hope other listeners will be as well.
yeah. I hope I could be of use today.
So I've got Dr. Derek on here. We go back to uni. We met in probably Freshers Week of med school.
Yeah,
One of my favorite memories has got to be going to Trinidad and Tobago for you and Kristen's wedding.
yeah,
Like
yeah.
probably 5 years ago now.
Oh yeah, 5, 6 years, long time ago, wasn't
I must ask, actually, why are you still in the UK when you've got so much extended family in
it? I
other
know. One
beautiful
day, I
parts of
need
the
more
world?
sunny in my life. I need more sunny in my life. So.
Okay.
Thanks a lot for having me today. I'm really happy to kind of introduce myself and discuss what I've been up to,
Yeah,
and to see your platform grow and see what I can help your listeners with as well.
yeah. So Derek, tell us, what do you do?
Yeah, of course. So my name's Derek. I'm a GP. I work up in Manchester. I'm in the Northwest. I've got a real passion for medical education. So this kind of filters through my daily work, my weekly work. So part of my week, I'm working as a GP,
Mm.
but I'm also a clinical lead for workforce education and within my area in the Northwest. And this is
Mhm.
something I'm really passionate about, helping resilience, thinking about how to create really good quality educational sessions for clinicians. So it's something that lends really well to my personality. And also part of the week, I then teach on the GP training program. So I do a few bits. And yeah, that's lended to the YouTube stuff that we've been discussing over the last few months.
Oh, so
Yeah.
it sounds like you wear quite a lot of hats. Like
Oh
just
yeah, it's a typical GP. It's like that's what I mean. For those that know me well, that's always been my personality. I'm always kind of involved in loads of different things. I've got loads of different interests, and I really do believe
you
that it's
do actually, Derek.
yeah, it's
But I
important
think
to
I was
develop.
thinking the other day, like, I can't believe you're in a band.
Yeah, yeah, I was in a band. Yeah, so
You've done a
it's
lot of
important to
different things.
develop it.
Yeah.
I think we're also multifaceted. That I'm really,
Multi-talented, multi-passionate people.
that's the thing, exactly. Yeah.
Oh, so yeah, you've kind of told us a little bit of an overview, but I want to really understand, what is it like going through a week in the life of Dr. Derek?
It's busy, but
Mm.
I mean, just balancing everything, obviously, family responsibilities and work. So I guess the beginning of my work is when I'm having my clinic. So the first 3 days, I usually be seeing patients. I'm also I have quite a kind of lead role in my practice. So I might be supervising allied healthcare professionals like our nurses or our junior doctors.
Yeah.
So it's quite busy, but I really enjoy it. I'm one of the few people, I guess, that from day one in medical school, I kind of knew what I wanted to do. So
Okay.
this is what I wanted to do. I wanted to be a
Yeah.
GP. So the beginning of my week is mostly GP work. And then I have a day in the week which I will spend on my clinical lead role. So quite a lot of meetings, setting things up. It's very
Kind
different
of
from the clinic.
things are you setting up?
Yeah, yeah. So thanks. So it's basically one of my passions is in developing relationships. So in improving relationship between primary care. So this is kind of GP surgeries and also secondary care. So this is kind of the hospital care.
Where we are.
Like what you're doing. So
Oh, okay.
bringing us kind of closer together. So a lot of my work is in arranging kind of educational sessions and seeing how we can foster relationships. So that's some of the stuff, and also a little bit about it's about retention of the clinical workforce. So what can we do to improve resilience? What can we do to kind of help people, and kind of develop the careers and feel like they're valued, and how can we retain clinicians within that area? So that's part of my week. So it's quite a lot, but it's really enjoyable, and it uses a different part of my brain. So I feel like I am
Yeah, to the clinical roles, like Monday to Wednesday when you're actually seeing patients.
exactly,
It's probably
yeah.
a different role when you're now thinking about how do you develop the staff that you work with.
Exactly, yeah, but it helps to and how I feel like obviously you work in NHS, it's like knowing the system, so you have like a bird's eye view on things. You kind of understand why things work a certain way, and it actually lends itself to your day job. You can understand a bit more about why certain referral pathways from hospital are this way. You know the consultants well. There's that relationship building. So it's although it's different, I'm using a different part of my brain. It's something that it works quite well. And even that lends to so most weeks I'll be doing some form of teaching for GP trainees. And this is essentially there's a theory aspect of they have to like pass a theory exam. So I'll be doing like a teaching like a topic like diabetes, men's health, something of that sort. So
Yeah.
most weeks I'll do some form of that as well.
Mm. So you might need to think about this question, and we can always come back to it if you
Yeah.
don't have a response straight away. But with being so involved in medical education, how do you know that you're making an impact on your trainees, and how do they kind of like feed back to you after you've had these sessions that see
Yeah, so
you're doing?
thanks for sharing that. Yeah, I think that's a really good question. And the thing about it is that I'm still quite relatively early on in my journey, although I've got quite a
Oh,
senior
got
role.
lots of roles in
Yeah,
that
but
level.
the good thing about it is because I've actually done these exams not too long ago, I've sat through them, I know what they're like. A lot of people at the end of my session, so we collect feedback and things like that, and I get the same thing saying that this is literally what I wanted to know. So that's what
That's
happens.
amazing. Yeah.
So it's important about, if you are delivering something, trying to be relevant, understanding your audience. Those are all really important things. And because I was the audience not too long ago,
Mm.
so that is how I know that I'm having that impact. And that's what even led me to do the YouTube channel, because I realized that there's a gap, and there were certain things that weren't really being satisfied. So that's answering that question in that kind of long-winded.
Yeah, yeah. So you're so close to the experience that the people you are teaching want to learn about. And you're
That's
able to kind of give them your lived experience and literally this is what you did to pass your exam so quickly.
exactly. And the thing about it is that the important thing is not seeing yourself as this junior person that can't give value wherever. Because in my role, even across my different roles, me being at this level has made me so accessible and has made me able to make such a big impact on stuff. So there's no point saying that, I'm too junior, I'm too early
Yeah.
in my career, because even you can make such a huge impact. And
Mhm.
and kind of thinking through that, anyone can start anything. Just have that confidence and keep going, really.
That's awesome. Yeah, you can't like put yourself, if you're putting yourself down or thinking you're too this or that, or you don't look like what the current leadership or management a body might look like or sound like or how they may come across, what age they are, then you could count yourself out from a lot of these opportunities. So
Exactly, yeah. In my role, I have meetings. So I chair meetings with other kind of
chair meetings.
yeah, I do.
Boss,
That's
boss
part of my
doctor.
role. Yeah, that's part of my role. And
Okay.
with my personality, I'm coming from a place where I know I might not be the most experienced, but I do have some value to give. And I've got some important things to give. And chairing those meetings and being involved in that forum, even though people might be more senior, it's not. I don't feel anxious or worried. I feel, like I said, I've got that real,
Yeah.
um,
You feel comfortable in your role
yeah,
and you deserve it. You're doing the work.
I think anyone can. I think anyone can, if I'm being honest. Yeah.
So you mentioned your channel. Tell us what is your YouTube channel and who's
Yeah.
it?
Yeah, good stuff. Thanks for asking that. So I set up a channel called AduMed.
Mhm.
It's a medical educational channel. And basically we look through the curriculum. So with GP trainees, they have a curriculum where they have to kind of go through. After each exam, they go through where did people struggle, where did people fail. Okay. And so we make videos, educational videos that are based on certain topics. And if you can imagine, as a GP, there are thousands of things you need to know.
Millions of
Exactly.
things
And
that
it's
people
still
can
in
walk
your
through
job as
the door with.
well.
Yeah,
But
yeah,
the main problem is that a lot of places, they will make you spend hours and hours on one topic. Whereas we're focusing on, this is literally what you need to know. So our videos are kind of 5 to 6 minutes long, and they'll
Mm,
go through the actual salient aspects of what, for this topic, these are the bits that you need to know to have passed the
yeah,
exam, is what people struggled with.
yeah.
And then with our videos as well, we then have case studies linked in. So case studies on like a real patient journey, and basically you can watch one of my videos. So we've got like a theory section and a case
Mhm.
study section. You can
Okay,
watch.
I don't think I've been going through the cases yet. I've
Yeah,
like
yeah.
gone through
There's a
quite a
case
lot of
study
your,
playlist.
your
Yeah. So
theory
you
one.
basically go through the videos, and then
Yeah.
so for some of the videos, they have like a case study, and you can see that, oh, yeah, this 5 minute video can take me through this patient journey, and I can very confidently answer these questions. So that's kind of our approach at the moment.
Yeah. So your channel, it sounds like it's mostly for GP trainees, but really when I watched it, because I'm a urology registrar, and I watched quite a few of your urology related ones or surgical related
Oh,
ones.
gosh.
They were super high yield. They were
Yeah,
like just like 5 minutes. Oh, this is the kind of rough overview.
yeah.
And definitely what you would need to pass the GP exam. And so I really enjoyed them. I
Oh,
really
thank you so much. I really, yeah, that means a lot, obviously, the urology perspective, because you obviously know your stuff. So, yeah, I mean, it's not something where I'm just saying only GP trainees can use it. Definitely not, because I've had a lot of, physician associates actually message me,
exactly. I
and a
feel
lot of nurses have messaged me as well. So definitely not. But one of the things that, I mean, I guess we might come to a bit later on, is that when you do start a channel, when you do start anything, you need to have a kind of target audience, or like a
in mind.
focus,
Yeah.
just because you could put yourself in the shoes of that person, and think about what kind of content they want to have.
Mm.
That will help with your retention, with your views, with your subscribers. So you have to start off kind of niche and be consistent with it.
Yeah.
So specifically, I definitely think anyone will get value from it, really.
Yeah.
But
Yeah, I was thinking like medical students should be listening to
definitely, yeah,
this. Like you said,
exactly.
advanced care practitioners, nurses, so
Yeah,
many people in like allied healthcare roles would
yeah.
benefit from just getting this like high yield digestible content.
Yeah, exactly. Yeah, thank you very much. That's, yeah.
No problem. This is not a sponsored promotion. So what would you say that your channel offers that's different to other channels out there?
Yeah, yeah. So it's mostly for me, the high yield stuff, the very targeted stuff as well. And also the way in which it's presented. So we use a lot of illustration, a lot of animation. So I know you mentioned
Really,
earlier on that I've got loads of different interests. So I'm quite
it's
artistic as well.
creative, yeah.
So it's got a lot of animation and things. So we kind of draw out images, we draw out pathways on the actual YouTube video. It's hard to explain without showing,
Mhm.
but it helps you
Don't worry,
to
I'll link your channel.
it helps you to really kind
It
of
does.
take things in, and kind of break things down in that way as well. And yeah, I mentioned with the case study aspect, you can see how watching the 5 minute video is linked to the curriculum. There's bits, those bits then should help you to retain that information a bit easier when you're going through that really pressure scenario in an exam. Doesn't only have to be an exam. When you're seeing patients, you can recall that information a lot quicker when you know it's a really short, succinct video as well.
Yeah. Oh, that's cool.
But it's really, I mean, I've had the really good opportunity to actually present it in 2 conferences this summer.
Oh, have that. Oh,
Yeah,
that's coming up, or it's happened already.
no, it's coming up. So in
Oh,
a few
okay, yeah.
weeks, I've now got to put the work to. I've
Yes.
got to prepare it. So yeah, it's a different way of approaching medical education, and thankfully that's been recognized as well. So I'll be this summer getting ready and at some conferences. So
Yeah.
you have to get.
Yeah. So, do you mind sharing which conferences they are, and
Yeah, of course,
maybe
yeah.
something
So I'll
that the
be
other listeners might either want to attend, or maybe might want to submit abstracts for in the future?
Yeah, definitely. So it'll be so I've got a poster presentation at the ASME conference. So I've got that in July, and in
Okay.
August I'll be doing a speaking engagement presentation
Oh,
in
okay.
AOME, so AOME conference as well. So
Mhm.
yeah, so I've just got to get my
Mm.
rights and stuff. But
Yeah,
even putting myself forward for that, for those roles, for that actual conference, for those two conferences, it's all based on, having a real genuine belief in yourself, having that confidence in yourself that you've got that value to give. I mean, I'm
exactly.
relatively new, it's a relatively new channel, but I could tell that my approach was different than what was out there. So
Hmm.
I was like, you know what, why don't I try and share it and see, see what comes of it? And, just like you do, I was like, okay, I'll apply for these conferences. Why not?
Yes.
And
Yeah.
and when you have that confidence in yourself
The
and that
belief in
belief in
yourself.
you,
Yeah.
that
Yeah.
pushes you.
Why can't it be me? Why won't I get the
Yeah,
opportunity?
yeah.
Yeah. Just
And you're not the finished article. I know that I've got so much ways and what I need to do to even get better, but that's not the point. You're trying to get better every day, but you don't get to that stage unless you really set yourself real lofty goals. You don't get there and just try and push towards that.
hmm. Yeah, I love that. And something I didn't expect you to say this, which is but when I asked, oh, what does your channel do, or what is it about your channel that's different to others? I would like to add that I would say your personality as well. So I didn't expect you to say it, but I'm gonna say it. Because like when you're doing something like and you're showing your individual flair, your individual approach or personality, that can be what like inspires a certain person, whether that's a trainee or otherwise, who may not have been as interested or as inspired by a different voice or
Yeah,
person. So
yeah,
that individuality and your unique way of either presenting or sharing information is also part of what I would say is your unique, selling point, as it were, the thing that
yeah.
distinguish your channel from somebody else or every other YouTube channel on medical education. It's
Exactly.
your personality. So,
And I think that's a really important point you've made. I think like representation matters as well. I think when you see people that look like you,
mhm.
it could be the same age, same race, but if you're seeing people that look like you that are achieving certain things, you automatically,
You're
we're
just like, oh, who's this brother?
yeah, exactly. So it's all part of that. Even for me to get to this stage that I was getting at, seeing people like, oh, you can do this. Oh, why can't I? Is that
Yeah.
thing? I completely agree. I guess having that different voice, and that kind of that link in terms of kind of representation and stuff like that. That is the unique point as well. In delivering the content I do
Yeah.
on my platform. Yeah.
Yeah, I love that you say, yeah, the representation. And that
Yeah.
brings me on to another point, which is about like widening access to medical education and even entry into the medical career pathway. Because I know that that was probably a very important value for you as you were deciding to take the leap into starting your own med ed YouTube channel.
Yeah.
So I'd just love for you to tell me more about that.
Yeah, exactly. So I'm so passionate about widening the education to the access and from what you discussed so far, just because for me to get to this point that I got to, I had to kind of in school and all that kind of stuff. I had to have access to some kind of support from that perspective. I mean, I went to a state school which was had lots of good teachers, but
Mhm.
to get into medical school, I had a lot of help, from people that might have been in kind of better resource systems and all of that as well. And thing is, it's coming from basically having access to really good quality free material. So all the
Mhm.
stuff I do on AduMed is completely free. And that,
Amazing. It
yeah,
means that like it's accessible to anyone that wants
that's the
to.
thing, yeah, because I genuinely believe that if you're coming from a perspective of giving value, whether it's your time or whatever, there are countless opportunities that will come as a result of that. I've had people that have reached out to me in the medical education space that I've been watching whilst I was a trainee or an F1 that
Oh,
wanted to work
really?
with me just because although I'm still building as quite a small channel,
Awesome.
I've I'm just giving out free stuff. And I really do fully believe that, if you start this way, even my role as clinical lead for workforce, I did a lot of stuff kind of in my own time as a GP trainee, and it's built me towards having a paid role. So I do fully believe that if you're giving out value, honestly, that will come back to you in terms of opportunities or kind of future roles. And that's an important thing. A lot of people will be like, oh, let me start a channel today. Am I going to get started paid? Am I going to get
it's like
that kind of thing?
YouTube won't pay you for a while.
It's not about that, exactly. It's having that internal motivation that it will really pay off. You just have to be consistent, and
And also, you don't know, like the seeds that you're sowing now, they may not be necessarily monetary immediately. Like you said, you're sowing into actually relationships,
exactly,
collaborations, and you don't know what will come as a result of that. And you're making impacts on people's lives that you may never have met. That's
the thing. People reaching out to me that I was literally watching a YouTube video 2 years ago, and you're speaking with me over the phone.
Derek, why haven't I seen the results of these collaborations yet?
It's all in the pipeline. Don't worry.
Okay,
it's coming. It's all slow. These things actually it's all slow, but yeah, it's all coming. Yeah.
That's good. I want to see more. We want to see more. Okay, so tell us, where can listeners find you?
So
with Dr. Derek, or watch AduMed.
So I probably suggest, in terms of, I've got an Instagram channel called AduMed, and which is basically has some of the content we put on YouTube, on Instagram, but in really short clips. And so literally I'll try and give you as much value as I can in like a 30-second clip. So I'll put it on my Instagram. But in terms of the actual content that you could, if I say you could watch this video, this is what you need to know about gout, or this is what you need to know about heart attack or whatever, that will be on my YouTube. So that's kind of got most of the kind of
that's where you need to go if you want
and so that's AduMed on YouTube, so you can find me on that as well.
Great. I'll link everything below, and I'd also we're going to continue rolling for some of my VIP clients. And I would love for you to share more about like just some of the things that you've experienced starting this content creation journey, because I know that's a big leap for you. It's not what you may have had like education or like insight into before, so I'd just love you to do that in our next video.
Good stuff. I'll be happy to do all of it. Thank you very much.
All the links you need to find us are in the description below. So also, I would love for you to comment to let us know what you think about this video, and if it's resonated with you in any way, I would love for you to subscribe, hit the notification bell, and also share this with somebody else who might benefit from this information. See you in the next video.